Permanent mandibular central incisor. Mandibular incisors are two in number. Mandibular central incisor and lateral are similar in anatomy and they complement each other in function. They are smaller than the maxillary central incisors. Mandibular central incisor erupts around the age of 7 and 8. There are various tooth numbering systems which denotes the tooth. Universal system, the tooth is denoted as 2, 4 and 2, 5. Sigmondi-Palmer system, it is 1, 1. FDA system, it is 3, 1 and 4, 1. This is a slide which shows the pictorial representation of the permanent mandibular central incisor. You can see various aspects over here: labial, lingual, mesial, distal, and the incisal aspect. So you can appreciate the tooth from the various aspects in this picture. The dimensions of the tooth: the crown length is 9 mm, root length is 12.5 mm, mesodistal diameter at the contact area is 5 mm, mesodistal diameter at the cervical line is 3.5 since it shows a lingual convergence. Labiolingual diameter at the crest of curvature is 6 mm, labiolingual diameter at the cervical line is 5.3, curvature of the cervical line mesial is 3 and distal is 2. Coming to the chronology of the tooth, first evidence of calcification is seen around the age of 3 to 4 months. Crown is completed around 4 to 5 years, and the tooth is erupted in the oral cavity around 6 to 7 years, and the root is completed 3 years later, that is around 10 years of age. So these are the dimensions and the chronology of the tooth. Now we see each aspects in detail. First is the labial aspect. Labial surface of the mandibular central incisor is very small. Narrowest tooth mesiodistally of all permanent teeth. It is bilaterally symmetrical. So as we said earlier, it is the narrowest tooth in the dentition. The shape of the tooth is trapezoidal. Mesial and the distal outlines taper evenly from the mesioincisal and the distoincisal angles to the narrow cervix. Since it shows a cervical constriction, convergence towards the cervix, that is the reason. Height of contour of the mesial and the distal outlines are at the incisal third. Contact areas are at the same level. Incisal outline formed by the incisal edge is straight and at right angles to the long axis of the crown. The mesioincisal and the distoincisal angle, they are sharp and they are at right angles. Newly erupted tooth shows mamelons on the incisal edge. This picture shows both the mesioincisal and the distoincisal angle. In comparison to the maxillary incisor, where the distoincisal angle was rounded, here you can note that both the mesioincisal as well as the distoincisal angle are at right angles and they are sharp. It is the only incisor where both the mesioincisal and the distoincisal angles are sharp and at right angles. The next aspect of the tooth is the lingual aspect. The lingual aspect is concave from the incisal edge to the cervical line. Cingulum is smooth and is barely visible. Below this slide, you can see a pictorial representation of the lingual aspect of the tooth. Here, the labeling shows IR, that is the incisal ridge, MMR, that is the mesial marginal ridge, DMR is the distal marginal ridge, LF is the lingual fossa, C is cingulum, and CL is the cervical line. Crown outlines are similar to that of the labial aspect, and it is narrower than the labial surface. So it has got a wider labial aspect compared to the lingual, since it shows a lingual convergence. So the lingual convergence of both the crown and the root is seen. The surface is smooth and flat in the incisal third and convex at the cervical portion near the cingulum. Lingual fossa between the marginal ridges and the cingulum is a smooth, shallow concavity. It is devoid of developmental grooves. This picture shows a mandibular central incisor where both the cingulum as well as the lingual fossa are labeled. It shows that, as you can see, the lingual fossa is shallow, conceived a deep one as that of the mandibular maxillary central incisor, and you can see a cingulum which is pronounced but not as pronounced as the maxillary central incisor. The surface is smooth and devoid of any grooves. No other tooth in the mouth except the mandibular lateral incisor shows very few developmental lines and grooves. The next aspect is mesial aspect. The labial outline is almost straight except near the cervical third where it is convex. The lingual margin is S-shaped. The cervical line on the mesial and the distal surface convex incisally. The picture below shows the mesial surface and the depth of the cervical line, which is deeper on the mesial aspect compared to that of the distal aspect. You can see the S-shaped lingual surface also, as it is noted there, and cervical line which convex incisively. And the convexity on the nasal surface is the depth is 3 mm compared to that of the distal, where it is only 2 mm. The lingual outline is concave or convex. Height of contour is at the cervical third on the cerebellum. Incisal outline is a small arc formed by the round incisal ridge. Incisal surface have a labial stop and clothed with the lingually stopping incisal edges of the maxillary incisors during mastication. Cervical line is curved towards the incisal ridge. This picture shows the nasal aspect, and you can see the contact area which is being labeled over here, and you can see the contact area is more incisively placed. The down, you can see the picture showing the convex cervical area. So cervical area shows the convexity, and from there you can see an inclination of the labial outline, and this almost a straight line. The next aspect of the tooth is the distal aspect. All the features of the distal aspect are similar to that of the nasal surface, but there are exceptions. One is the cervical line, which is curved, but the depth of the cervical line is not as deep as that of the nasal side. The cervical line is curved towards the incisal ridge, and this is the depth is only 2 mm. You can note the contact area also over here. As a similarity to the nasal aspect, here also the contact area is more incisively placed. We can say that both the distal and the nasal aspect shows the contact areas at the same level, and the cervical line is less curved. The next aspect is the incisal aspect, oval labiolingually. This aspect illustrates bilateral symmetry of this tooth. Labiolingual diameter is greater than the mesodistal diameter. Newly erupted tooth shows mamelons which wear off upon mastication. Labiolingual dimension is always greater than the mesodistal dimension. Bilateral symmetry of the tooth is easily appreciated. More of a labial surface is seen than the lingual surface because of the lingual inclination of the crown. Root. Normally, this tooth has got a single and straight root. From the labial or the lingual view, root is generally symmetrical and tapers gradually to a native sharp apex. From nasal and distal view, root is much wider and is slightly convex cervicoapically on both labial and lingual margins. Central portion of nasal and distal surfaces is usually flattened or concave. In cross section at neck, outline is roughly a rectangle with rounded corners, but it is slightly wider at labial than at lingual. When there are root concavities present, they are reflected as concavities in the nasal and the distal outlines. The mid-root cross section is similar to the cervical section, only more ovoid. The picture which is shown below shows these concavities on the nasal and distal aspect. That is about the various aspects of the tooth. Coming to the traits of dentition, there are various traits of dentition. There is arch trait, set trait, type trait, and glass trait. Here today we are discussing the arch traits of the mandibular central incisor. Mandibular central incisor, the arch trait is maxillary permanent central incisor, and the differences between these two. Crown is wider mesodistally than labiolingually. Lingual fossa is pronounced often with the lingual pit, more prominent cingulum and marginal ridges. These are the features of a permanent maxillary central incisor. Permanent mandibular central incisor, the crown is wider labiolingually than mesodistally. Lingual fossa is a shallow, without grooves or pits, not that prominent cingulum. Each aspect wise, there are differences between these maxillary and the mandibular incisors. We'll go aspect wise. So, the labial aspect. In maxillary, permanent maxillary central incisor, it is wider and less symmetrical. Nasal contacts are more incisively located than the distal contact area. We have got a more rounded distal incisal angle where the nasal incisal angle is sharp. Common labial depressions can be noted, and more cervically located contact areas. And level of the nasal and the distal contact areas vary. They are not at the same level. In comparison with the maxillary permanent central incisor, in mandibular permanent central incisor, it is long, narrow, symmetrical crown. Nasal and distal contact areas are at the same level. Both are incisively placed and at the same level. Nasal and distal line angles Incisal angles are sharp. That is, incisal and distal incisal angles both are sharp. In maxillary, it is the distal incisal angle is rounded. Less frequent label depressions, which is a characteristic feature in case of a maxillary permanent incisor. Contacts with the contacts very near the incisal edge. Both the mesial and distal, the contact area is more incisively placed. So the next is the lingual aspect. In maxillary permanent incisor, you have got more pronounced marginal ridges as well as the cingulum. Deeper lingual fossa, but in comparison, mandibular central incisor, the lingual surface is smooth and almost not that prominent marginal ridges are there, but it's not that as pronounced as that of the maxillary incisor. And the lingual fossa is also sharp. So the what features you see on the lingual aspect is not that pronounced as that of the maxillary incisors. Sometimes lingual pits are knotted in the maxillary incisor, but nothing like that. Since the cingulum is not prominent and the fossa is not deep, pits are not seen in the mandibular incisor. They've got a larger cingulum for a maxillary permanent incisor, but the cingulum is not, it's a small in case of a mandibular incisor. Central incisor has a cingulum which is placed slightly distally placed in case of a maxillary, but in a mandibular permanent incisor, it is centrally placed and it is perfectly symmetrical. But a lateral incisor show a slight distal tilt for the cingulum, mandibular lateral incisor. The next is the proximal view, that is the mesial and the distal aspect of each tooth. So maxillary incisor, the incisal edge is laid to the root axis, but in mandibular, the incisal edge or lingual to the root axis. There is an elevated cingulum in maxillary incisor, but the mandibular incisor shows a very small cingulum. Roots are narrower in maxillary incisor, especially in the pectoral third, but mandibular incisor, their roots are noticeably wider, facial-lingually, with the depressions on both sides of the roots. In incisal aspect, you can see the crowns are wider mesodistally than facial-lingually. Incisal edge labeled to the mid-root axis. Central cingulum is to distal and lateral. In lateral incisor, cingulum is centrally placed. Mandibular permanent incisor, crowns wider facial-lingually than mesodistal. Incisal edge is lingual to or centered on the mid-root axis. Central cingulum is centered. Lateral incisor, the cingulum is distally placed, but centrally in central incisor, the cingulum is centrally placed. In lateral incisor, the crown has a round outline, but in case of a mandibular lateral incisor, it is more oblong, facial-lingually. Central has more triangular crown outline. Central incisor, it is oblong again. Lateral incisor is convex labially near the incisor area. Lateral and central are nearly flat labially near the incisal ridge. So these were the various aspects of the tooth as well as the traits. Let us summarize. So if you take each aspect, these are the points which we need to remember. Labial aspect, the shape of the tooth is trapezoidal. The mesial and the distal outline. Mesial, it taper evenly from the incisal angles to the narrow surface. Incisal angles, it is sharp and right angle, both the mesial incisal and the distal incisal angle. Incisal ridge, straight and perpendicular to the long axis of the crown. Mamnons are seen in the newly erupted tooth, which disappears. Crown symmetry, it is bilaterally symmetrical. The labial surface is smooth, convex, and flattened incisally. Contact areas, both mesial and distal contact areas, are at the same level, and they are more incisally placed towards the mesial incisal and distal incisal angle. That is regarding the labial aspects. Lingual aspect, it is trapezoidal in shape. You can see a lingual convergence. So the crown is narrower towards the lingual aspect, and a broader labial aspect is seen. It is wider labial. Cingulum, small, and it is not that prominent. Lingual fossa, shallow. It is a shallow concave area, and it is smooth and devoid of any pits or grooves. Marginal ridge is present, but it is not as pronounced as that of the maxillary incisor. So you can see it is redefined. Incisal edge, it is slopes labially. The next aspect is the mesial aspect. It is bed-shaped. Labial and lingual outlines. The labial outline is straight, and it is convex only at the cervical third. You can see a slanting, straight line from the cervical third to the cusp. Inside lingually, it is concave or convex. So the cingulum and the lingual fossa makes it a more concave or convex. Convexities and the concavities will be noted. Incisal ridge location placed lingual to the root axis line. Lingual inclination of the crown. Crown is inclined lingually on the root base. True for all mandibular teeth, it facilitates the normal overjet. Distal aspect, all the features are similar to the mesial aspect, but some exceptions are there. Cervical line curvature is less in extent by 1 mm. Mesial aspect is 3 and the distal is only 2. Incisal aspect, it is oval labiolingually. Coming to the relative dimensions, crown is wider labiolingually than distally. Crown is bilaterally symmetrical. Equal mesial and the distal halves can be noted. More labial surface is seen. Incisal ridge edge. Yeah, edge is at the right angles to the labiolingual bisecting line. The root, it's a single rooted tooth, and you can see a single pulp canal. So it is a long root and form how it's conical in shape, convex, mesodistally, and flattened the labiolingually. And usually it is straight, and sometimes it shows a distal curvature, and the apex is pointed. So these are points which, when you summarize the mandibular, permanent mandibular central incisor. Okay. So these are the features. Hope you remember all the features.